Let's go on to your treatment because you've kind of brought it up with the breast surgery. And tell me a little bit. So we talked about it a little bit before that you went in and you went in for the surgery thinking they thought maybe it's not going to be a big surgery, maybe it's localized. And what happened when you woke up from anesthesia? You were recovering. How's the news broken to you? And another thing you said you never got reconstructed. What led you to that decision?
That decision was because, actually, in hindsight, probably a stupid one, but the plastic surgeon that I wanted wasn't available because he was on a medical leave and he wasn't available for 3 weeks. And I said, forget it. I only want him, and if he's not available, I'll go without, I'll get it later. Mm-hmm. And then this is another lesson. You know, I probably had that cancer. Now I realize all along. By the way, always get a second opinion. I got the second opinion after at Dana-Farber, and they reclassified the cancer. So when I came to that post-operative meeting, and the doctor said, I have even, you know, I'm not telling you what she actually said, but I'm going to rephrase it in my sordid sense of humor. Sorry, but you only have 3 years to live.
And that must have been a...
So we go from you don't have cancer to didn't show up on the mammogram till it's localized to it's in 4 lymph nodes to you got 3 years to live.
That's a roller coaster. Really, that's an emotional roller coaster right there.
So I got a second opinion, and at Dana-Farber they're like, you don't have that kind of cancer.
And so did they talk
Get a second opinion.
And obviously that worked for you because they told you that it's, you know, you can live
so
longer.
So my point that I was going to make is that, yes, many people feel when they have cancer that, you know, there's an evil monster inside them and cut it out right away. No.
So you can take a deep breath.
Take your time. Get all the facts. Get that second opinion before you have your surgery. Because you have that luxury in this country anyway, to get a second opinion in most cases. And you are going to be a far more informed individual with that. Don't jump to conclusions. Don't don't waste time when you have maybe so precious time left. And that would have been that was a game changer for me.
So you're saying unless it's an emergency, then maybe get all your ducks lined up in a row, understand the disease, understand what you're dealing with, you know, take another opinion if you can, and then kind of go after it full tilt.
Exactly. So you do have time. You know, when I realized that I probably had, this tumor, by the way, was the size of a golf ball and never showed up on a mammogram. What does that tell you? That tells you that there's 15% of tumors that don't show up on mammograms. Well, that's 85% of them that do. If you had, and I tell this in my speaking engagements, if you have an 85% chance of winning a lottery ticket, you're gonna go out the door and go buy one. This is not a message saying, well, I'm not gonna go get a mammogram, didn't work for her.
Right.
Number one, today, the technology is so vastly improved, is it not, Doctor?
Yes, it's changed. The mammogram has improved. There are other guidelines which have come up also.
The high-tech.
In women who are at high risk, sometimes MRIs are recommended, but that's for high risk, family history.
Exactly.
So there's a lot of other things which are available. You're exactly right.
I feel that, you know, that was 2003. We've come such a long way.
Absolutely.
In so many regards. In that point in history, I was, you know, maybe in that regard at a bad place in time. But relative to the aromatase inhibitor, for example, I was in the perfect place at the right time.